I'm deeply appreciative of this award from the New York Academy of Medicine, named in honor of Dr. Stephen Smith, who is a public health pioneer, an Academy Fellow, and founded the American Public Health Association. Dr. Smith's background, I think, is quite meaningful to me. He was not just the son of a cavalry officer from the Revolutionary War, born in 1823, but trained in medicine at Columbia's College of Physicians and Surgeons, and then did a residency at Bellevue Hospital. But he was an astute observer, and he recognized clinically that tenement housing, poor hygiene, and other environmental conditions in New York City contributed to outbreaks of typhus and cholera. He did the research to substantiate this and then led a landmark report on the sanitary conditions in New York City in 1865, and then went on to lead effective sanitary campaigns. He led recognition of the need for a well-organized public health system that would be staffed with well-trained professionals to improve these conditions. And in response, New York City created the Metropolitan Health Board, where he then served as a commissioner. In 1872, he created the APHA, the American Public Health Association, to create a national network of scientists and physicians and, as he said, ignite civic support for public health. With that background, I was asked to offer some thoughts on what gives me hope and what gives me pause looking forward. And there are two issues that are related that do both. My own optimism stems from what we now know that we didn't when I was in geriatrics training, that prevention works and matters in older as well as younger ages. However, we have not deployed this knowledge adequately across the life course. If we did, estimates are that we would add almost 6 years of health to people's lives, and this would go a long way to resolving disparities. My hope and my concerns center around this, that we have increased longevity with people living long lives with less health. To solve this, we need to recognize the evidence that medicine and public health are two essential sides of the health coin, if you will, both essential to having a healthy population. However, the U.S. has progressively disinvested in public health over the last 60 years, leaving anemic capabilities for old agendas and little for the new ones. The solution, to echo Stephen Smith's words, must include igniting civic support for public health, to get us to invest in a public health system that can create healthy longevity, adequately financed, with reinvigorated capabilities, and with a well-trained workforce. What gives me hope is if together we can, across medicine and public health, push successfully for a new generation of investment in the public health system we need as a public good that raises the floor and the ceiling of health for everyone, so that we have the basis for creating healthy longevity for all, and at the same time enabling medical care to be more successful. Thank you so much.